programmer for MultiCare.
A skilled workforce is critical to America's economic future. The U.S. Department of Labor, along with state governments and employers, helps prepare hundreds of thousands of American workers for about 1,000 different family wage occupations. Traditionally, these registered apprenticeships have been associated with specific lines of work, such as the construction trades. But as demand for healthcare workers skyrockets, the U.S. Department of Labor has now identified 53 healthcare occupations that are apprenticeable, and that number is growing.
Apprenticeships are very important to MultiCare because it is a way for us to not only develop and grow our own, but it is a much more economical way of gaining talent and technical skill that otherwise we may not be able to buy in the market.
MultiCare is a nonprofit health provider in Tacoma, Washington that operates 4 hospitals and more than 90 clinics in a 4-county area. Each year, MultiCare invests close to $1 million in employee training, including apprenticeships, which combine elements of on-the-job learning with a clinical supervisor, related classroom instruction, incremental wage increases, and a certificate of completion that is recognized nationally. Christina started at MultiCare as a certified nursing assistant, but decided to expand her credentials in the rapidly changing healthcare field by enrolling in the Health Unit Coordinator, or HUC, apprenticeship program.
The classes I took were offered here at MultiCare free of charge. And I was able to go directly after I finished my shift in the hospital, so that way it wasn't cutting in to much time at home with my family. It was financially, obviously, it was wonderful, even as little as the gas that it would take to drive to and from school. After being in a certain field for so long, you get stuck in a rut and you get a little scared to go back to school, but this has shown me that I can do it. That's something that I see throughout the whole system here at MultiCare is education. It's the key. It's going to take you farther in life. And so I've definitely felt supported within the education that I've done. And if I choose to do more, I know that MultiCare will have my back.
HUCs are the air traffic controllers of individual units within hospitals, skilled nursing facilities, outpatient clinics, public healthcare agencies, and other settings where healthcare services are provided. They manage communications, paperwork, and patient activities, and coordinate between doctors, nurses, and other healthcare providers.
In a way, we're all serving an apprenticeship of sorts. We're all in a learning program to some degree. Well, Christina's, she's the first person that often our patients will see. Yep, they'll get checked in. They'll come in the room. And Christina's, she is doing the check-in. She's the first person to figure out what is going on. We are all going to be asked and are being asked to do more with less, to get more work done with fewer people. That is the nature of it. So to have someone who can learn new tasks, or maybe learn on the fly, or if not, be shown something new and be able to pick up new skills constantly, that's extremely important.
Publicly recognizing and celebrating the achievement of those critical skills is also extremely important at MultiCare.
This is your certificate for completing the apprenticeship. You are now a Journey Level Health Unit Coordinator, which is very, very cool.
Christina received a certificate from the state of Washington which recognized the fact that she did her didactic. She did 240 hours of didactic coursework and passed that with flying colors, and then went on to do 2,000 hours of on-the-job training. Now that's 1,240 hours to train for a job. Now we have an employee who is now trained in the MultiCare way, trained very well because we trained her. It was an internal training program. And she has a journeyman's card in her hand also that says she has done this. And this is what I can do. She can go anywhere. She could leave MultiCare and go anywhere as a HUC now because she's recognized by the state. That's what the certificate was for, to recognize that effort. And she doesn't want to leave. And nor should she. We don't want her to leave.
The organization is extremely supportive of workforce development programs because we believe that developing our own employees develops a sense of community, a sense of caring that then gets translated to our patients. What that means to our employees is there is opportunity always within the system to grow or into a bigger job or to stay where you are and develop even more in that job. It helps our retention rates, it helps our recruitment rates, our customer service scores get a boost, our employee engagement scores get a boost, and in the long run it makes for better patient care.
For each of their 3 apprenticeship programs, MultiCare identified a local community college to provide the classroom training. In some cases, that classroom training takes place at a MultiCare location. MultiCare also partners with the workforce development community, unions, and other organizations. MultiCare's engineering apprenticeship, which was registered by Washington State in 2011, was designed to meet the ever-expanding needs and technical sophistication of its physical plants. For Alex, who works in the Environmental Services Department, it's a chance to advance his skills, grow into a long-term career, and improve his family's economic well-being.
For the past 6 years, I work in environmental services by doing, floor care, delivering hospital supplies. My job description is basically responding to all the hospital calls, working with the AGV, the automated guided vehicle, the tube system, by monitoring in the computer, working with the fire alarm, nurse call system, and all the troubleshooting calls.
The apprenticeship program is the first apprenticeship program in the state of Washington that I know of that specifically targets hospital engineers. The reason for that is the growing technology and the diversity of the skills needed are hard to find in mechanics. So instead of trying to look for that, we created a format and a didactic requirement around what we needed for hospital engineers. So it was a natural marry with the Washington State apprenticeship programs because it gives us the capability of using the apprenticeship resources through the technical colleges.
Alex and other apprentices commit to 18 months of school called didactic training and can earn an associate's degree with just 6 to 8 additional credit hours.
When your staff have confidence that you're truly interested and committed to their professional development, the morale goes through the roof. So this is a way that we're committed from both a company standpoint and from a personnel standpoint that we're driven to get to the same level, and that's educating our staff. The cost savings benefit is I don't have to spend $15,000 to $20,000 to go out and recruit somebody. I can take the talent that we have within MultiCare, put them through a set standard of training, and come out with a highly qualified technician.
Yeah, this is really a great opportunity for me. Professionally, this will give me myself to advance, to improve my skills, and to be able to move up in the future.
MultiCare reached this point in developing their apprenticeship programs after first starting an on-the-job training program, not a formal apprenticeship, in an area they deemed critical, training licensed practical nurses, LPNs, to move up to registered nurses, RNs. The LPN to RN program not only saved MultiCare tens of thousands of dollars in recruitment costs, it formed the basis of the Health Unit Coordinator and Engineering Apprenticeship programs. Today, MultiCare is enjoying soaring employee morale and strong retention rates, which in the end is fulfilling MultiCare's core mission, providing stellar patient care and safety.
I'm happy. I'm really happy. I wake up every day and I look forward to going to work. And to me, that's worth more than money.
To explore how registered apprenticeship can help your organization, read the report and case study, Apprenticeships in the Healthcare Industry. For more information, go to www.skillupwashington.org. Begin your journey today. Learn more about the return on investment apprenticeship yields.